Hi, welcome back here to our channel at Antai Hospital, and today we'd like to dive in the topic of adenomyosis and GnRHa treatment. So GnRHa treatment is another conventional treatment here that's offered in a lot of major hospitals for the treatment of adenomyosis. Although it does achieve the elimination of the pains, it has some side effects and it cannot guarantee fertility. So let's learn about that and what's a better alternative that we offer here at Antai Hospital and why it's better. So GnRHa simply stands for gonadotropin releasing hormone antagonist. So there are a few examples that you need to keep in mind so that when you go for these treatments as well, you will be able to identify them and you'll be able to have a discussion with your doctor. Educate yourself so that you won't be able to fall in for uh, unwanted, unnecessary, invasive treatments that your doctor tends to blindly recommend, especially GnRHa, which is quite ineffective. So the common ones especially is triptorelin. Secondly, we're looking at leuprorelin. Thirdly is diferolin. And lastly, gonadorelin as well. So these four are some of the most common ones that you might encounter in any major hospital. And why we believe that it is ineffective, because it simply suppresses your menstrual cycle. How it does that is that it inhibits the secretion of important hormones by the pituitary gland. So it's a hormonal condition. It's affecting your hormonal imbalance for a long-term period. And what that causes is that although it eliminates the pains, it causes inability to get pregnant, infertility. Furthermore, it also affects your mood, causes some depression, chronic anxiety. It also leads to premature onset menopause. That's a very severe one because it can lead to hot flashes and mood swings, and also it affects your sex drive and it can cause osteoporosis, all of which is closely associated with menopause. So if you go for this treatment in your 20s, you'll experience menopause in your 20s if you go for it consistently. And furthermore, this is a treatment that deals with only your symptoms, so it means that you need to go for it regularly. You need to get injected every once a month, maybe twice a month, and the cost isn't cheap as well. And if you stop treatment, immediately the pains come back because the adenomyosis is still there. We already discussed many times adenomyosis is simply the presence of these displaced endometrial tissues that have become abnormal. And what we need to do is simply remove them or cause them to experience cell death, not just dealing with the symptom. So if you do not remove it, you do not deal with adenomyosis. If you go for these GnRHa injection treatments, it simply deals with the symptoms, so you need to deal with the consequences and the long-term side effects. Now, before the discovery or before the availability of minimally invasive techniques that can remove them effectively that we do now here at Antai Hospital, it's perfectly acceptable that you go for GnRHa because the pains of adenomyosis is extremely severe. However, in today's age, especially 2022, no longer we need to depend on treatment methods of the past. We can avoid that now and go for much more modern, much more effective treatment methods. Now, an alternative that you should consider is the 3D laparoscopic removal of these adenomyomas. Now, here at Antai Hospital, we do that simply by entering into the pelvic cavity directly onto the uterus using 3D laparoscopy, which is a minimally invasive technique, and we deal with the root cause. Dealing with the root cause for any disease is the only surefire way from eliminating it, and you do not need to be dependent on any type of medication. Any type of treatment that allows you to come for regular injections, regular pills, it means it only deals with the symptoms. Something that deals with a root cause should only take one course of treatment, one surgery, or maybe two, three, but nothing more that's regular. And this 3D laparoscopic minimally invasive technique simply injects a medication we know as apoptotic agents directly onto the adenomyomas, causing them to experience apoptosis. So that means they are completely removed. And then you can experience benefits of restoring your menstrual cycle. You can have your balanced mood, better quality of life. Most importantly, you can achieve natural pregnancy and the pains are eliminated. So when we compare these two, it is very obvious which is better. Now, GnRHa treatment is still very popular, and as I've mentioned, the side effects, if you have no intentions of getting pregnant, then you may consider it, and if you are financially well to do as well, because each injection costs up to several thousand as well. But for the minimally invasive technique, you only need to go for one course of treatment, which is one surgery, and it can achieve better outcomes, significantly better quality of life, no more menstrual pains, and you can achieve natural pregnancy. So, in conclusion, you can already make a clear decision on your own, make a judgment on your own, which is already the better treatment and why you should choose the minimally invasive technique. And furthermore, I'd like to end this video that you should avoid hysterectomy if you are an adenomyosis patient. Hysterectomy is no longer necessary and completely destructive towards the patient and significantly worse than GnRHa treatment. So now that you know that there are several different types of treatment, which is the best for you? Definitely the 3D minimally invasive technique, and we do offer that here at Antai Hospital with a full refund guarantee. Now, if you still have a recurrence, if you still experience these pains, if you still are unable to get pregnant or you keep miscarrying, we offer you full refund guarantee. That's how we ensure patient treatment outcome. We are the only hospital to be able to do this contractual system where we guarantee results, and if we do not, then we offer you full refund of the treatment costs. And that's the only way that we achieve trust between our patients here at the hospital. So please visit our website, talk to our consultants. If you're interested in seriously getting your adenomyosis treated once and for all, leave me some comments down below, and I'll see you in the next one.